I think it's crucial that staff understand what the patient needs are, and you only get that understanding from listening to patients.
Feedback for patient care is very important because negative or positive we can make changes to how their future care is affected.
Patients need a voice because we want to learn from them how we can improve the quality of care that we offer.
Patient-reported outcome measures reflects the effectiveness of care and also the patient experience in relation to that care.
PROMs is the first step, I think, of the NHS attempting to capture real quality of care for patients.
Quality is everything to us, quality of care, and looking at how we can objectively measure that and how we act upon it is critical to us.
I think the PROMs be really good. I think feedback is always, it's not kind of thing you can just stop and start. I think it needs to be continuity, it needs to be happening all the time.
Once patients know about quality of care, then patients will be able to decide where they're going to go for their treatment. The results of a PROM will be made available for all, and patients will then be able to see from their before their operation status to then their post-operation status how their quality of life has improved.
But we haven't been so good in the past about getting the patient's perspective, the whole experience they get in the hospital. What's their experience been like before they come in, the communication that they've had from the hospital, what they're expecting out of their operation, whether actually we've achieved what the operation was trying to achieve. Is their quality of life better? Have you become more mobile? Has your pain reduced? All those sorts of things we haven't systematically recorded in the past.
It's important to know how good we are at treating patients. Although hip and knee replacement, for example, is a very successful operation and makes a massive difference to people's lives, we know that from the look on their faces and what they tell us when they come back. But it's good to be able to quantify that so we can tell what we're doing well and what we're doing badly and which areas of the patient journey we need to improve on so we can provide the best quality of care in the future.
Yeah, and working on what the patients want rather than anything else, because it's feedback from the patients is what it needs.
Definitely worthwhile what you're doing, and to get as much feedback is helpful for the NHS to react, if you like.
At its heart, patient-related outcome measure is about you as a patient, what your experience was like in having your operation, rehabilitation, pain therapy, whatever you're having. What will happen is you'll get a questionnaire before you come in from the operation, and you'll fill out various things about what your quality of life is like before the operation, what the key things that you're facing in going in for the operation, and scoring overall how you mark your overall level of well-being. How healthy do you feel before the operation? And then you come in, have your operation, hopefully have a wonderful experience, and then 6 months after the operation, once you've gone in, you'll have had follow-up care from physios, OTs, therapists, etc. as part of your rehabilitation, as well as your surgical procedure in theatres in the hospital. And then we'll ask you in a questionnaire 6 months later, what's changed? Have we achieved the benefits that we were trying to achieve?
Yes, I think it's a good idea because it also gives the confidence to the patient and also whoever's doing the hip replacement, or show anything that they can learn by it.
The relationship between a doctor and patient is paramount. I think the continuity of care between doctor and patient is very important because patients have to learn to trust their surgeon. And certainly as a surgeon, I value the relationship, not just with my patients actually, but also with the relatives. If I'm treating children, the parents, I'm very privileged in the work I do, really.
So I think for staff it's very important when the staff get feedback, then they can make positive changes, because not everybody has a positive experience in a hospital. So from feedback it's a learning curve or a way that people can learn and make improvements for the future. Definitely a good idea.
I think that the patient surveys that are going to be used to measure outcome in hospitals will be great for staff, because actually what they'll see for the first time is some direct correlation between what they deliver and the satisfaction of patients. And again, that can be a great driver for change.
And I'm delighted to see now that in the health service, real quality is going to be measured. There's no doubt that I think PROMs and actually having the patient fill in a questionnaire on all the surgical procedures that are carried out is actually a huge step forward for patients and for us as surgeons to know that what we're doing for patients is significantly beneficial.
I have no doubt constantly measuring what we do will empower us in really identifying the tools of what I call quality improvements. In other words, go back, redesign, whether that's at the pathway of care or look at the technologies you might be using in making that care even better.